Okay. Hello, everyone. Welcome and welcome back to our first Health Literacy Seminar of 2021, where the Canberra Health Literacy Network brings you speakers who can improve our knowledge of what health literacy is and why it's so important for good health outcomes for consumers, and how both consumers, health professionals and health services can improve our health literacy. I'd like to acknowledge as we begin today that we're hosting this webinar on the traditional lands of the Ngunnawal people here in Canberra. I pay my respects to elders, past, present and emerging. And wherever you, our listeners, are watching and listening from today, I acknowledge and pay my respects to the elders of those lands too. I thank them for their care of our country, and I warmly welcome Aboriginal and Torres Strait Islander people who are joining us today. So thank you for joining us. My name is Kate Gorman and I'm the Deputy Director of the Healthcare Consumers Association. We have over 100 people registered to join us both today and after the event to access the resources. So I thank you for your interest in this webinar and in the Canberra Health Literacy Network. This network is for anyone who cares about making it easier for people in the ACT to get, understand and act on health information so they can make good health decisions, look after their own health and get the care they need for themselves and their loved ones. The Canberra Health Literacy Network is an initiative of the Healthcare Consumers Association and is supported by the ACT Health Directorate. The network's steering group brings together representatives of the ACT Health Directorate, the ACT Office for Mental Health and Wellbeing, Calvary Hospital Bruce, Canberra Health Services, Capital Health Network, Carers ACT and the Healthcare Consumers Association. Today, we welcome Herbert Down as our speaker. Herbert is the Director of Partnering with Consumers at the Australian Commission for Safety and Quality in Healthcare. You might know that health literacy is a part of the Partnering with Consumers healthcare standard, and that means that there are steps health services must take to ensure that consumers can understand different aspects of using the service and what their choices are. Partnering with consumers is an overarching standard, and that means that elements like health literacy become part of the way health services deliver every aspect of that service. A little housekeeping before we begin. We really welcome your questions and your comments today, and we'd love you to share them by typing them into the chat function. All of the other participants will then be able to see them and respond to what you're saying. We won't have, people will remain muted today because we're expecting a lot of you. At the end of his presentation, we hope that Herbert will have time to answer some of the questions you've asked today. We may not get to all of them though. So the questions we don't get to, we will answer by email to all participants after the event, and we'll also post those answers on the Canberra Health Literacy website. And you'll be able to see the URL for that in the chat function as I speak, I understand, if you'd like to have a look at our website today. We will be recording the webinar today, and again, we'll provide a link to that recording by email and also on the Canberra Health Literacy website. So the theme of today's event is focusing on health literacy to improve safety and quality. As you listen to Herbert, I invite you to reflect on what you're doing well with health literacy in your service and what you could improve in this area. Feel free to share your thoughts with us in the chat. Please join me now in welcoming Herbert. Thank you.
Good afternoon, everyone. Thanks, Kate, for inviting me along to speak to all of your group today. I'm going to take you through a little bit of a presentation about health literacy from the Commission's point of view, and that's really a pan-Australian point of view as well. Before I begin, I'll let you know that I'm a pharmacist by profession, and while I didn't necessarily learn about health literacy 20 years ago in university, I realise now that much of the education we were provided with actually contributed directly to improving the health literacy environment for people who are receiving medicines. And I think never before has it been so important to ensure that people are very clear and understand the instructions associated with their medicines and other parts of healthcare. So I'll get this started and hopefully I will do it correctly first time. And share. And we're off and running. Okay, So in our little talk today, I'll give you a brief overview of who and what the Commission is. I'll tell you what we mean by health literacy. I'll let you know what problems we've identified that really means improving health literacy around the country is extremely important. I'll show you some of the stuff that we're working on here at the Commission to help improve health literacy, and then I'll give you an idea of what might need to be done next. So for those of you who don't know, the Commission is a national government organisation. We are funded by both the Commonwealth and the state and territory governments. So that means when I come to work every day, I have at least 10 bosses, including my own CEO, and we need to keep them all happy all of the time, which is a tough job. We've got a piece of legislation that guides all of our activities, and within that, we've got 4 important strategic areas of priority: patient safety, partnering with patients, consumers and communities; quality, cost and value; and supporting health professionals to provide safe and high quality care. Health literacy actually sits across all 4 of those areas in slightly different ways, but it's important to all of them. So what is health literacy? Health literacy, as far as the Commission is concerned, has 2 different definitions. We have the individual health literacy, and we also have the health literacy environment. For any patient who comes to, our consumer who comes to the health service organisation, there are so many words being thrown at them. In some ways, it's an entirely different language. And not only that, but they're emotionally vulnerable, going through a difficult time, and probably not in the best position to try and absorb and understand a whole lot of information that in some cases they really don't want to understand anyway. Our health system is extremely complex. We've got a public and private mix. We've got health insurance companies. We've got a primary care sector. We've got support services, community services. And as a patient, trying to get to grips with all of that to try and find the help that you need, and at the same time take on board very complex information about your own situation is obviously very, very challenging. A couple of years ago, the Commission did a large piece of research and put together a national statement on health literacy. As part of that process, it was identified that there are 2 components that lead to the health literacy environment. The individual health literacy is defined as the skills, knowledge, motivation, and capacity of a person to access, understand, appraise, and apply information to make effective decisions about health care, and then take the appropriate action. So even within that is quite a few actions required to ensure that somebody not only understands what's going on, but can make informed decisions about the courses of action or next steps. On the other side, the health literacy environment is the infrastructure, policies, processes, materials, people and relationships that make up the health system and have an impact on the way people access, understand, appraise, and apply health-related information and services. As we go through the talk today, you'll notice that I'm speaking about the system level and from a national perspective, but I'll try and offer some implementation examples or local examples where it's appropriate. So for the health literacy environment to be helpful to the entire population, of this equation need to be operating optimally. So that means for the individual, not only do they need the academic, if you like, background to understand words and concepts from their schooling, but the health service organization that they're interacting with also needs to be providing them with information that's tailored to their needs and preferences. Okay, so a little bit of background that you're possibly already familiar with. Just short of 60% of Australians have a level of individual health literacy that is below the minimum required for individuals to meet complex demands of everyday life. So that's a staggering almost 2/3 of Australians don't have enough literacy to actually put together all of the information that they need to make a sound decision. So for example, matching words with a pictorial representation like a graph, and then trying to understand what that means for the decision that they're trying to make. For those who speak English as a second language, that number rises to 75%. So as a country of migrants, that represents a really huge barrier to good quality health outcomes. There are a number of factors that are key to influencing your level of health literacy. There is a difference between the sexes. Your level of educational attainment is a huge factor. Whether you're cognitively impaired or or have a disability of some sort can be a barrier. And then there are a number of influences such as ethnic background that can influence health literacy. So why does it matter overall? Ultimately, people with lower levels of health literacy have poorer health outcomes. They're far less likely to use preventive services. They're much more likely to be hospitalized. Medication adherence is definitely poor. Understanding and having knowledge of their own condition is far less than those with good health literacy, and they're more likely to attend appointments. In older people, that obviously means that their risk of death is higher and their health status will also be poorer. All of this can add up to a dollar value. And in the US at this point in time, they estimate that between 3 and 5% of total health spending is impacted by health literacy. At an individual level, this can vary from $143 for somebody with non-complex needs to almost $8,000 for a person with very complex needs. Here in Australia, we began work in the early 90s with some conceptual work on policy, goals, and targets. Through the 2000s, the ABS were able to put together some figures that gave us an idea of what the literacy picture around the country looked like. In the late 2000s, policy reform began in earnest, and processes were put in place to improve literacy as a national priority. Here at the Commission, we've been working since about 2010 on a stronger focus on person-centered care and the requirement and role that health literacy plays in ensuring consumers participate in person-centered care, and hospital organizations provide person-centered care. We're continuing to work on the concept. We're developing some measurement and tools, and hopefully over the next couple of years, you'll see even more coming from the Commission. So at a national level, the Commission's document, which you'll find on our website, the National Statement on Health Literacy, is attempting to draw awareness to the problem. There are a number of supporting documents that go with it, including a summary for clinicians, which is a really short read, but gives some practical examples of what can be done on an individual clinician basis to actually improve the health literacy environment for patients and consumers that these clinicians are dealing with. There's also one for health service organizations, which can help design systems and processes which will then improve the health literacy environment for a cohort of patients within the organization. A coordinated approach is really important, and I'll talk shortly about some of the bigger picture activities that will really help to improve health literacy. The document also talks about the role that individuals as well as organizations can play in improving health literacy in Australia. And there it is. Okay, so if we're going to look at a coordinated and collaborative approach, Then embedding health literacy into systems is talking about ensuring a health service organization understands exactly who its patients are, what languages do they speak, what educational level have their patients and consumers attained, and then asking their consumers how it is that they like to learn. In this way, you can prepare different forms of materials to share with patients. You can train staff to identify individual patient needs, and then they're in a position to provide suitable materials onwards. You can also ensure that staff have been trained effectively in communication. For those of us that are clinicians, I'm pretty sure none of us really remember any dedicated modules other than perhaps an individual workshop through our formal education on communication skills. But really, it's a vital thing to have when you're providing patients and consumers with information. And a poorly communicated piece is at best ineffective and at worst damaging to the relationship that you have with your patient or consumer. At a national level, integrating health literacy into education is a vital element in improving the health literacy level for everybody in the country. It would be wonderful if primary and secondary education students went through a module or more describing the terms that are commonly used or they're commonly going to meet as they go through life, so that when they begin having conversations with clinicians, the words are not a surprise or not entirely meaningless to them. And I'd certainly like to see lots of questions about ibuprofen or paracetamol dosing included in mathematics curricula in the future. So when we're trying to ensure that people understand the materials that the information that we're providing to them, it first has to be in a form that they understand. Not everybody responds to the written word. Not everybody responds to verbal communication. So a one-size-fits-all approach is not appropriate. We can test the effectiveness of the conversation that we're having by using some techniques that test recall. And that's really important to ensure that we're not bombarding people and that whatever it is that we're providing to them, they're able to walk away and ensure that it'll be retained. I remember when I was counseling patients on medications, I had a 3-dot-point rule. I needed to get home 3 important points about whatever prescription they were going to leave the hospital with. And that changed for each medicine because not every safety requirement or not every instruction is equally important. And then there was one day I met a patient and I attempted numerous times to hit my 3-point rule with her. And after about 20 minutes, I realized that she didn't understand the words that I was using in any which way. But when I wrote them down in numerical form for her, the message started getting through. So I left her for a couple of minutes, went off, typed up the information using numbers and a couple of pictures, and that seemed to work really well for her. I also remember a beautiful story from northern Queensland about a nurse who was looking after TB patients from Papua New Guinea who would come in for treatment. For those of you who are not familiar, TB treatment is incredibly complicated with numerous medicines that are taken at numerous times across a week, and then not at all on some days of the week. And through a process of trial and error, ultimately, this nurse designed a picture album with pictures of the individual medicine jars and tablets, and found a way to represent the instructions clearly for these children and for their carers. And she was able to measure a reasonably small cohort, but she was able to measure for them a much improved adherence to the treatment. And that was validated in their lab results improving over 6 and 12 months. So sometimes it takes a little bit of innovation, and it takes a little bit of thinking outside the box to meet an individual person's health literacy needs, but it can definitely be done. So we talked about ensuring that you're testing the effectiveness of your communication techniques. So there are some useful things that you can do. Excuse me. And one of those is, of course, the teach back technique. So asking a person to actually repeat back or demonstrate back that which you've just taught them. And this is particularly useful for medicines that need to be injected or applied in a very particular way. And then you can also use some coaching techniques so that you've got an iterative improvement in a person's understanding of what it is that you're teaching them. So from an individual consumer point of view, the language of health is very complicated, and we like to make it complicated. The language that clinicians use when speaking to each other or when writing about an individual patient is often very, very technical and is almost meaningless to the average person on the street. There are ways, though, that we can embed basic health literacy information into the curricula so that in future generations have that as part of their formal education. Again, during my formative years in university, I don't remember a particular time when any of my lecturers spent much time at all explaining that there was a huge variety in the needs of individuals that we would come across in our pharmacy experience, and that we needed to actually work with them to ensure the instructions we put on labels or the information that we provided them met their needs. And it's not something that comes naturally to people necessarily, but it is something, and for that reason, it's really quite important that all of our nurses, all of our doctors, all of our clinicians spend quite a bit of time during either their training or during that educational phase learning about health literacy and how they can contribute to improving it. So then if we've got both our clinicians and our consumers or patients well involved in the health literacy environment, we've got to make sure that the information, so that's the relationship, the interaction between the two, is working really, really well. And the only way to do that is ongoing training, feedback to both the clinician, feedback to the clinician from the individuals who are receiving the information about what went well during the interaction and what didn't go so well. I think I've pretty much jumped a little bit forward on this one. So it's really important within health service organizations in particular that part of the training program focuses on health literacy, and this is on an ongoing basis. And again, it's really important that health service organizations look at their local communities to ensure that they're meeting their language, educational attainment, and other needs, and that, you know, the information that, or that the form of information they were providing in the last 5 years still meets the needs of those individuals. And of course, over the last 12 months, we've had a unique experience with COVID-19, and there's been some very rapid and great innovation in adapting the way services are provided. And we need to make sure that in implementing those changes, the information that we're providing still meets people's needs, and that our communication techniques and strategies are actually suited to the form of consultation or meeting that we're having, whether it's by telehealth or on the phone or even through a chatbot, as is the case for some services. So if we were to look at how health literacy needs to be embedded, it needs to go from the very top. So the policies and procedures that describe what information should be available, how it should be available in each of the clinical areas is really, really important. And I don't think I have much more to say on that one. So having spoken about health literacy and education in school curriculums and in our university curricula for clinicians, the next thing to talk about from a national point of view are the National Safety and Quality Health Service Standards, which are now in their second edition. The first edition was released in 2012 and was reviewed through 15 to 17, with the new standards being launched in 2018. As Kate mentioned earlier, partnering with consumers is one of the foundational standards in the national standards, along with clinical governance. But each of the standards mentions health literacy to some extent or other. The standards themselves aim to improve the safety and quality standards for patients in health service organizations across the country, and almost 1,900 hospitals are required to be accredited against these standards. We license the standards to assessment agencies who undertake the assessments themselves. And we are now in the third year of assessments. COVID interrupted things very briefly, but we are confident this year that assessments will begin again. The Commission looks at the assessment data, and in fact, our programme is currently looking at the Partnering with Consumers information, which I think covers 1,300 unique assessments to date, to try and understand what hospitals are doing really, really well and where they're struggling, so that we can target our activities over the coming years to help improve the implementation. The Partnering with Consumers standard itself has a wide-ranging number of actions, and it goes from describing the activities a health service organization should be undertaking with consumers at a planning or evaluation level, right down to aspects of shared decision making and health literacy for individual consumers, to ensure that person-centered care is being delivered and that consumers really do play an active part in making decisions about their condition and managing their condition. So to that end, some examples of how health literacy is covered within the standards. In Standard 1 governance, making sure that your signage is very clear, and that people with some disabilities, for example, impaired vision, are able to make their way around the hospital. Or if you live in, if your hospital is in a community with linguistically diverse people, that you've got a variety of languages available to help them find their way around the hospital. Standard 2 obviously itself has a health literacy criterion, which talks about understanding the community's need, providing easy to understand information, confirming an understanding and sharing decisions, and then involving support people where a consumer or a patient would like them involved. Standard 5 is the comprehensive care standard, and here shared decision making, goal-directed care planning, and involving support people are core to ensuring comprehensive care plans can be delivered on. Health literacy contributes directly here in helping consumers understand their condition, and then also making informed choices about how they would like that condition managed, and then deciding on what goals they would like to achieve as their condition is being managed. It's also very hard to have meaningful conversations with people about with consumers about future decisions around their healthcare if they don't understand fully what kind of questions to ask and the seriousness or the impact the information they're being given has on their condition and on their future. So here are 3 of the actions involved in Standard 2. These describe in detail what is expected of a health service organisation to demonstrate that health literacy is embedded at all levels of their health service. And these are the actions and the criterion that assessors will be looking at when they arrive into a health service organization. So for Action 2.18, the Health Service Organization uses communication mechanisms that are tailored to the diversity of the consumers who use its services, and where relevant, the diversity of the local community. So what you'd be looking for there is a plan that examines the ethnic diversity of the catchment area in which the health service organization sits, and then also the diversity that's represented within any outpatient clinic that might visit the hospital. And from that information, which obviously you would gather at fixed intervals, you have an action plan that describes how you're going to either offer translations, access to translators, or resources in multimedia form. So perhaps you need to have Braille available, or access to people who speak, who can sign Australian Standard Language. So as an individual clinician, or a manager within a clinical area, what is it that you can do specifically to help improve the health literacy of your environment? The first thing that you can do is recognize the needs and preferences of individuals. I've probably said it ad nauseum already, because I do tend to repeat myself. One size fits all is not going to work for health literacy. We need to really understand what it is that those people that access our services need, and what we can do to provide it to them. And the best way is to start asking initially. And from there, you can probably build a more formal process where a short survey, or semi-structured interviews with a small sample of consumers who access your service. And from there, develop a plan which will then help you develop the resources that you need to meet their individual preferences. For an individual clinician, that could be as simple as asking how a person would like their discharge information provided to them, or what way do they prefer to take information away and call back with questions later on, or something along those lines. Tailoring the communication style to the individual goes hand in hand with the needs and preferences of individuals, and sometimes that might mean you need to take quite a long period of time with some people, and sometimes it's useful to actually leave somebody with the information and come back a short while later to offer the opportunity to ask additional questions. And quite often it's useful to have a different type of clinician come back and check the individual's understanding, as often a specialist or a senior clinician some people are not open to having those conversations, but will more readily ask questions of a nurse or a pharmacist for fear of wasting the other type of clinician's time. It's really important to assume most people will have difficulty in understanding and applying complex health information. So what that's really useful to do is to sense check the message that you're about to provide, and how you're going to provide it, and to really strip it back and make sure that the language that you're using is as simple and as straightforward as possible. Avoiding jargon is obviously really useful, and avoiding technical language of health is also really useful. We talked earlier about using a range of techniques to confirm understanding. Teach back is really useful. Getting somebody to demonstrate is really useful, and then also giving that gap to allow somebody to sort of play with or look at the labels on medicines, or the summary of care that you'd like them to follow up with. They're all very useful. And then there's plenty of evidence-based ways of communicating risk as well, and you'll find some of those on our website, the link to which I think will follow shortly. If you're looking for some resources that the Commission has developed over the years, you will find them all on our website. The Top Tips for Safe Healthcare is a useful little pamphlet for patients, which lets them know the sorts of things that they need to know about going to an appointment or looking after their health. We've got the question builder, which you'll find on the Health Direct website or from a link from ours to there. The question builder is a unique resort that was developed with ARC in the USA, and it allows a consumer or a patient to think about their appointment in advance and to choose some questions that they might like to ask their clinician. I think all of us have had white coat syndrome at a certain point in time, walked out of an appointment, and then thought of the 8 things that we'd really like to have asked the doctor while we were in front of them. The question builder can be sent, the questions chosen can be sent direct to the clinician in advance, or you can bring them along on your phone or written on a piece of paper. And it gives a little bit of time and takes the pressure off actually trying to think on your feet. I mentioned earlier the health literacy, a summary for clinicians. There's also one for health service organizations, and there's an introductory fact sheet as well for quality managers to help them with implementing the criterion 3 health literacy. Look, I hope in my brief talk today, I've demonstrated that health literacy is a safety and quality issue. Good communication is critical, and ultimately, when we're providing training to our clinicians, it's important to understand all of the issues that might affect our local populations, and that includes the diversity in culture, background, and educational attainment. Ultimately, and I hope this has come through as well today, everybody within health has a responsibility to reduce the barriers to health literacy, from the individual clinician all the way up to the health service managers and indeed the government level policy makers. If you'd like to find any information about what I've spoken about today, you can go to safetyandquality.gov.au. Follow our Twitter handle, twitter.com, and it's ACSQHC. And you'll also find some 200 odd videos on YouTube on various topics, many of which are designed for consumers and often can be a really useful resource.
Thank you, Herbert. I think we lost you for a little while there in picture, but we could hear you all the way through. Thank you very much. Yeah. Now we do have, and thank you for the chat and the questions that you've been sending through on the chat function, folks. So we do have a couple of questions for you, Herbert, now. Give you a moment to wet your throat. Okay, so the first question is, the standards apply to health service organisations. What incentives are there for GPs and specialists in private practices to improve their health literacy and the practices?
Look, that's a really interesting question. We administer the GP standards, but those are actually designed by the College of General Practitioners. And look, ultimately, it's one's professional responsibility to understand the patients that you have in front of you and the consumers that access your service, and ensure that you are providing information that's meaningful and useful. The element of surprise, so that bit when a consumer has an outcome that they weren't expecting, or something does actually go wrong, is made all the worse because understanding is poor. So I think that professional lever is the most important one for both of those settings. Kate, you're on mute. I can't hear you.
Sorry, still get caught out from time to time. Thank you. Here's another one. So we know that there are a number of advanced planning kinds of documents that consumers and clinicians can use, things like advanced care directives. We have the My Rights, My Decisions toolkit here in the ACT. What role do those play in the standards? Where do they fit in?
So they fit into the Comprehensive Care Standard. And that talks to the fact that health service organisations are required to have policies and procedures to ensure that advanced care planning documentation is stored carefully and delivered to the patient's desires, preferences and wishes. So that's where they fit in. The language here is always really difficult because the states and territories each have slightly different terms. And then there is a slight difference between that document, which talks about specific actions when a person is no longer able to make the decisions for themselves, versus a longer term plan, which talks about choices that a person might like to make at different points in their continuum of care. And this is one that is likely to change quite a bit, whereas the other is less likely to change, but still can, obviously.
Thank you, Herbert. I think I'm having a little trouble with my camera here, but I can still talk and pass the questions on. So another question that's arisen here is one that we hear quite often, which is that has the Commission done any work on how good health literacy practices impact the lengths of time that clinicians spend with consumers? I know that when I talk to students, as I sometimes do, about these kinds of communication tools and techniques, one of the comments I often get is it takes a lot longer to do things that way, and that's the resistance that we sometimes see there. This person on the chat has said, for example, we would double the appointment time with a nurse if we needed to have an interpreter. Have you got any thoughts around that?
It's a really interesting point, actually, and I find one of the time question is one that comes up across a number of issues when we're talking about improving safety and quality, and it's one that sort of wears me down a little bit, I have to say. I think the need to extend the length of an appointment, for example, because an interpreter is required, is actually what's required to ensure the patient or consumer gets the service and that they require. Now, how a health service goes about planning for that, that's a complex and difficult issue. But I think I might take a note away to see if I can find some data that looks at that particular issue. And I think longer term, bigger picture, if you spend an extra 15 minutes with a consumer and an interpreter, and that prevents them being admitted to hospital unnecessarily 2 weeks later, then that's probably 15 minutes worth of investment that's really, really good, great and vital. And I think the carving out the short times within a day, when my day is already really, really jam-packed, is complex and it's stressful. But we do need to look at the impact on the individual when you haven't actually spent the time or invested invested what was required to make sure the information gets across.
Thanks, Herbert. We might follow up with you after today for a bit more information and maybe some links to anything we can find that is around how to manage, that time versus good communication problem. Okay, so I think that this is probably my last question. And one of our participants has said, can you provide some examples or perhaps suggest some places to go to look at evidence-based ways of communicating risk.
Sure. So the Commission has modules on risk communication, and they will be updated very shortly. 3 of the colleges have them as part of their mandatory training, but you'll find links on our website, which I can provide to you, Kate, afterwards to be distributed elsewhere. I think from memory, it's 4 modules, possibly 2 hours worth of training altogether. And obviously littered throughout those modules, you'll find links to papers and to other websites which will provide even deeper detail. But the modules themselves are extremely good training material.
Fantastic. So we might circulate that to our participants today and after the event. And I think we'll include the link to the National Statement on Health Literacy then as well. Okay, so that's all of the questions that are in the chat that I can see. So I think that probably finished putting you on the spot, Herbert. Thank you very much for those great suggestions. Our time together now is coming to an end, so we'd really appreciate it if you could take the time to complete a quick feedback survey today on today's webinar. The link is about to come up in the chat box on the bottom right. And we'd love your thoughts as well on any views you have on future network events that we could run that would be useful to you. And if you haven't already visited our website, please take a few moments to do that if you can. That website is a central point for information, tools and training for health literacy in the ACT. And we hope that you will become users, contributors and champions of the site. Keep an eye on your email inbox for the link to the recording of this webinar, the questions and answers from today and more information that we'll be sending to you. And also just general information about the network, which we encourage you to share with the people in your networks. Thank you again for your interest in health literacy and for being here with us today. We hope to see or hear from you online again. And please get in touch if you've got some more ideas for this network or you'd like to chat with us about health literacy. Before we go today, I'll just let you know that our next health literacy seminar will be on March the 26th, and that one will be about health literacy for nurses. So it will be a practical look at how to bring health literacy skills and practices into this role. So once again, thank you, Herbert. Thank you for joining us today. It's been fabulous having you, and goodbye, and we'll see you next time.
Thank you.
Thanks, everyone.